In healthcare, there is a shortage of 13 million doctors. How do we bring this together when we think about the health of developing countries, the health of communities, the health of people, the health of nations?
What was very difficult a few years ago, which means, for example, in terms of infrastructure, you need to deploy in the hospital the whole platform. Nowadays, using cloud solutions or using mobile phones, these barriers can be overcome.
In Libya, they have an emergency service for civilians. We established a chatbot that enables the users in distress to use the call, use the phone to connect, but also to use the chatbot to send the GPS location or pictures or photos to the operators, so that the localization of the distress and the emergency can be more effective, and reducing also the time for the operators to treat this emergency.
Cervical cancer affecting many women. Definitely something that is a treatable condition if it is diagnosed early. But women don't walk to the doctors, don't walk 2-3 days, don't take the time to leave their job or their kids behind. And so we need to bring the digital tools through telemedicine, empower the community workers that are in the school or in the village to connect with an expert miles away and to provide the right diagnosis.
The difficulty we always find at start is that how to create a mind, a culture for collecting the data, governing the data, and sharing this data.
What I see is that data have the opportunity to save lives. Trend is really related to precision medicine.
We are very lucky because there has been a strong evolution in terms of regulation, in terms of infrastructure. We produce technology to solve a social issue. It's not a matter of using mobile telephones. It's not a matter of using cloud. It's a matter of how are we going to reduce the disease burden in the population.